honest questions with honest answers. This is Unfiltered, brought to you by the Emergency Medical Minute. All right, listeners, welcome back for another episode of Unfiltered. Today we have the privilege of being in the highest emergency department and full-service hospital in the world, St. Vincent's Hospital in Leadville, Colorado. And we're here with Dr. Lisa Zwerdlinger, who has a multitude of roles both here in the hospital and within the community, and has a fascinating career that I'm really excited to learn more about. So, Dr. Zwerdlinger, thank you for being with us today.
Absolutely. Happy to be here.
All right. So, Lisa, we have, I've primed you a little bit for this, but essentially I think there are so few people who do what you do in the country, and you can tell us more about it, but essentially Lisa does primary care in the clinic, she does OB, she does the ER, she does inpatient medicine, consults at other hospitals. How did you get to become the first woman of medicine in Lake County, and can you tell us a little bit about kind of how you got to where you are?
Absolutely. So I came in the late 90s, right out of residency. Interestingly enough, I was negotiating a contract for Bethel, Alaska on the Arctic Rim. I'm an avid ice climber, and the Couloir climbing there is extraordinary. But my husband at the time had seasonal affective disorder and couldn't tolerate the long winter nights. So Leadville was our compromise, where it was cold and snowy most of the time, just a few annoying months of summer. But the ice climbing is great the rest of the year, and so that's how we wound up here.
That's wonderful. That's excellent. Can you tell me about tell me about your training and how you got into wanting to be the kind of physician and provider that you are now?
So I always knew that I wanted to go into medicine. That was predetermined, I think, from the time that I was a child. But through medical school, had a hard time deciding on what I wanted to do because I liked everything. And all of the rotations that I did as a third-year medical student were great. They were fun. I certainly enjoyed most of them. And during one of my last rotations, I had the privilege of having a family medicine resident be my senior resident, who looked at me one day puzzled and said, "Well, Lise, you could go into family medicine and you can do it all." And then the little light bulb went on, and I did my fourth year focusing on knowing that I wanted to come to a rural area and be a family physician.
And I know that practicing in a rural setting is something that's very important to you.
Absolutely.
And can you comment on advocacy for your patients? I think that so many of the folks that you take care of every day are underserved. You work in a critical access hospital, and just kind of what your personal approach to advocacy is and how that takes up your time and how that interacts with your practice usually.
One of my favorite stories is when my car broke down. And I had to have it essentially pushed to my office, and it was in the middle of the parking lot, stranded. And I went into the office and was taking care of patients. And then I came out in the middle of the day to just try and maybe get it out of the traffic, and it was gone. And I thought, I wonder what's happening. And then I
saw today going differently when I woke up.
And then I came back. I went to the office. Something happened, and I had to run back in, and I essentially forgot about it. And then when I came back at the end of the day, went back out into the parking lot. It was parked in its usual spot. The keys in the ignition, and it worked just fine. I called the sheriff, and I said, so I was new to town. I probably had been here maybe just a year or two. And I thought, is that a little strange that my car was broken down and then, now it's fixed? And he said, well, at least we take care of our own. And so what some beautiful person had done, and I actually never figured out who it was, saw that my car was in the middle of the parking lot, not working, had taken it, fixed it, and then brought it back and never asked for anything. And that is our community. That's Leadville, and that's what we do for one another. And that's been my mantra since I've been here is, we do the right thing for our own, and we take care of them. And it's not hard to do when you're in a community that is as delightful and lovely as the one that I live in.
That is a wonderful story. And tell me about kind of your vision for taking care of patients here. If you could design a system that took care of your folks, your family here as you wish that it could, what would it look like?
Well, it's exactly what we've created here, is true integrated healthcare. And that, I think the big problem with medicine is that care is very disjointed, and you go one place for one thing and then another place for something else, and no one knows you. No one is invested in your well-being. No one cares to put you together as a person, and not just someone who has kidneys and someone who has a mental health issue and then someone who has heart disease, someone who really actually knows you. And that's what we've created here. And we are very fortunate in Leadville to have have, I believe, one of the most integrated systems ever. And that's because we have a very strong primary care base. We have primary care providers here who have been here for a long time, who know their patients, who are excited and interested in taking care of their patients, who see them at the soccer games and the ski races, and who help them grocery shop. And we can integrate our healthcare delivery system where when I see someone crying at Safeway, I know who they are. I ask what's wrong. They come see me in my office. I can plug them into the mental health services that are available, and I understand who they are. And integration of healthcare is the thing that Leadville does just beautifully.
And much to be learned from the rest of the state and the country, to say the least.
I always, anyone who will listen, I always brag about that.
We were just talking about that earlier this morning. I mean, I think a lot of our listeners will identify with frustrations at a fragmented system wherein you're seeing patients constantly coming back to the emergency department because they can't, there's a breakdown in managing chronic conditions, or they have terrible difficulty in getting in to see a primary care provider or to see a specialist if needed. And I think that is a microcosm of what a lot of the ails the American healthcare system.
Well, and that there's limited health insurance options, is difficult. My husband always coined the phrase, babies for burritos. And certainly I have done a lot to take care of the underserved population who just can't pay me. And we write off their charges. And then there's, a bundle of burritos that show up at my office as a thank you. And, those of us who have a lot, and I certainly am very fortunate to be one of those, need to share for those who don't. And it's not hard to do when that effort is spread out amongst an entire community.
Can you help us picture what it was like when you first came to Leadville? What was healthcare in Leadville and Lake County, Colorado like when you first started here?
It was a mess. There was... we had one of the highest infant mortality rates. Women had no access to prenatal care. They were still delivering babies in their bathtubs. It was a mess. There was very little child care. Vaccination rates were not as high as they could be. There wasn't a lot of coordination of care where someone needed mental health services and they didn't get them. People needed dialysis and they just had to move because there was no option for them. They didn't have any transportation options. And one of the first things that I did was would go to the local gathering places and just listen. What do people need here? I was right out of residency. I was in my 20s. I really didn't have a lot of life experience at that point. And I wanted to hear what the people needed. And I listened. And over the last, over the ensuing decades, we put together the system that worked for the people.
How did you build it? Who did you need to get as a stakeholder? How did you push it to become what you wanted it to be? I'm sure it was really easy and very straightforward. Yeah.
Well, I never believed that there was any discrimination based upon age or gender because I refused to see it. And I definitely, got a reputation that maybe wasn't as flattering as it could be. Breaking into the good old boys network was difficult at best. I remember an interchange that I had with the Road and Bridge director years ago. We were at a county commissioner meeting, and I was talking about the delivery of emergency services and how it really was all of our responsibility. And the director of Road and Bridge looked at the county commissioner and said, "Would someone put her on a leash?" And this gentleman is enormous. He fills a doorway when he walks into the room. And I, of course, am very small. And I looked straight at him and I said, "Sir, do we need to take this outside?" And he's loved me ever since. So I think that there are barriers everywhere that you look, and you can certainly, run against them and not do anything about it, or you can find creative ways to break them down. And we found a solution. We found a way to provide emergency services in our community that would be able to get an ambulance out to a 911 call, which was huge. Yep. We didn't have much of that when I first got here. So I think the way that it works is that you always do the right thing. And again, you always come back to your mantra, we take care of our own. And when you have that in mind and that's what you want, people eventually come to you and give you what you need.
It's truly a community. I mean, How have you seen the community in Leadville change since you first started?
Yeah, well, obviously it's much bigger than when I first started, and there's lots of folks moving into town now for economic reasons because it's a more affordable community than our neighbors. Mm-hmm. And so I see the community grow significantly. Unfortunately, the marijuana culture has embraced our community as well, and that has changed the way that I practice medicine. There are so many people now who poison themselves routinely and just don't have the insight into how it negatively affects their well-being, and it's hard to take care of that population. We do, certainly, and then of course we'll always take care of them, but they have less insight into their illness than others, and that's been a big change.
Tell me more about that. I mean,
so we're a college town, so we have a college that is here, and we are a bedroom community for the larger resorts that surround us. And the young people that come to work in those, often when you ask them, so what brought you to Colorado, a significant proportion of them say it's, marijuana is legal here and I like to use marijuana all day long. And so they come in, after they've been here for a while, and, the common complaint that I see, right, is, the 25-year-old who a chief complaint is doesn't feel well. And within a couple minutes of being in the exam room, I can understand, I don't have as much energy as I did. I feel like I have problems focusing. I feel more depressed than I have. Sometimes I don't want to get out of bed. I don't feel as though I did, 5 years ago. And so going through their history, so what's changed? Well, I moved to a new place. I have a new job. Maybe I'm not eating as well as I should. And I smoke marijuana all day long. Or I chew on gummies or, whatever it is I use. I use, THC all day long. And to get them to make the leap to say, well, there's 100 things this could be, common things being common, I wonder if it has to do something with, your daily marijuana use. They can't make that leap. And the vast majority of those people are so stuck in that cultural decision that they can't come out of it. I always, I'm a parent of teenagers, and so I look at them and I say, you know what, I can lecture all day long. I've got a long lecture repertoire. However, I found that not to be helpful, and then people don't come back. So let's do our due diligence. We'll do other testing, and other laboratory studies. We'll get, a mental health evaluation. We'll do our due diligence. But I want you to keep in the back of your mind that this may be as simple as that you're doing too much of a depressant medication, and maybe if you did less of that, you would feel better.
I think that's a valuable perspective. There's such a discourse now about legalization of marijuana, and I think there's obviously a lot of components to that discussion about proposed health benefits that probably don't have any sort of true scientific backing, and I think there's social arguments that I think that your perspective as someone who has spent her entire career caring for an underserved population whose motives couldn't be questioned. What ulterior motive could you possibly have? You've committed your career to working in this community. To hear that from you is that's a powerful testament. It's disappointing, certainly. That's not the community that you have worked hard to build, and that's not the kind of, you wouldn't want that for your patients, for their health, but that's a powerful testament.
Well, and as part of my introduction into, why marijuana may not be good for you, I often put it into the same realm as alcohol and tobacco and fast food and, French fries and, those kind of things, is that, as humans, we tend to poison ourselves, and some cultures are more likely to do that than others. But, just as much as you shouldn't smoke marijuana all day long, you shouldn't eat, hamburgers all day long either.
Yep.
And obesity is an issue as well that negatively impacts people. And so I think once you frame it in that context, people understand a little bit better. And I have been told more than once that people have stopped their negative behavior because my interactions with me are so annoying that they can't walk back into my office and hear the lecture again. So they stop.
Whatever it takes.
Which is great.
Whatever it takes.
I'll turn cartwheels if that's what it will take. But if it just takes me being a little annoying, that's easy to do.
Yeah, I agree. It is part of a greater problem with kind of self-destructive behavior and mental health, right? I mean, it certainly can't be extricated from that, but Yeah, I mean, I think it's a problem that is facing more and more communities in that way.
Absolutely.
I appreciate your perspective on that. What else is it like to practice in Leadville? For our listeners, what are the folks like if you were to describe your patients and the clientele of this town?
Well, for the most part, we're a hearty group. You can't, there's that bumper sticker, right, that says that we're here because we're not all there. And I believe that to be true. Living at extremes of high altitude where it's cold all the time, a sunny day in the summer of 65 degrees is, it's a warm day. We all break out our shorts. The whole idea, about, summer sports, if you, like baseball, we usually get it one day a year to play that on a Tuesday in the middle of July. Just because there's snow on the ground the rest of the time, and I guess unless the baseball's orange, it's hard to find in the snow. But I think that we're a hearty group here, and the people who have called Leadville their home for years on end definitely have a lot of grit to them. And I ranch, raise cattle, and the livestock community is just it's nobody takes anything for granted. And when there's tragedy, everybody, comes together. We had a horse die unexpectedly a while ago, and just devastated my kids. It was a horse that they've obviously had for a while. It was a rescue horse, and someone that was very important to our family. And within a couple days after the word got out that we lost one of our drafts, we had 3 others show up. Wow. With people who just trailered their horse and said, we heard the kids lost a horse. We wanted to offer, if we could give you one. It's that kind of cohesiveness that I know if I need something, if the helipad is covered with snow, I can call and get a plow truck here within minutes. If the power goes out, we will have emergency generators here to take care of everyone. If we have a snow-in where our elderly patients can't get out of their driveways, people will come shovel. Whatever you need, we take care of each other. And I don't know many places around that are like that. I don't know many places where when I am desperate because something has happened, I make 2 phone calls and we get what we need. That's the best part about living here.
The best part? Even better than climbing mountains?
You can climb mountains. You can climb mountains in a lot of places, and I have. But the community is what keeps me here. When you love your job, you don't work a day in your life, and it's never hard for me to get out of bed and come to work. I love what I do.
Having just started to work here, I can see why you feel that way. I certainly can. Can you tell us about things that your hobbies, things that keep you busy outside of work? We can talk more about the practice of medicine here because I think there's a lot there, but what are the things you get yourself in trouble with?
And so that's where and I raise children. God bless my husband. He is a full-time rancher, a full-time father. I couldn't do it without him. The support staff is definitely necessary, and he is gracious and allows me to live my life practicing medicine and taking care of our community, and he takes very good care of me and our family, and so that definitely makes it happen. We don't have free time. It's anyone who parents 2 teenagers knows that there is no free time at all, between running back and forth from this practice and that competition, and then anything that might be construed as free time is all taken up by the cattle because they're awfully needy. They do what they do, but it's an important lifestyle, and I certainly when my husband and I talked about how we wanted to raise our family, clearly ranching, the farmer lifestyle is what we wanted to teach our kids, and about work ethic and responsibility and how to be respectful to the planet and to the animals that they raise, and how to make sure that they're going to be good citizens of the planet obviously is very important. And as we all know that youth in every generation sometimes struggles with understanding their place, and where they will be productive, and how to be successful. And it was very important to my husband and I that we raised children who were honest and worked really hard.
Where do you think that comes from for you? I know that you and your husband have fostered that in each other and as you've grown your family, but you came into that relationship with a background in that. Where do you think it comes from?
I come from a military family. My father was career Air Force. and yes ma'am and yes sir, and it was I watched both of my parents work really hard to support us, and that nothing was ever given to us. I grew up in a very poor part of town, and it was important for all of us to have that same work ethic. So it comes from where I came from.
Did you grow up here?
So that's a good question too. I grew up on the other side of Mosquito Pass as a young child, and then unfortunately my father died when I was 12, and then we moved to the city to be closer to resources. And then my mother raised, my brothers were gone during that time. They were quite a bit older than I am, but then she raised me alone in the city.
Okay. And then you went to school in
University of Colorado.
In Denver.
Yeah. So I did Boulder undergrad, and then medical school in Denver, and then residency was also at the university.
Okay. And your first job out was here?
Yeah. I quit every day for the first month. I walked into an established practice that had been here, for I think 100 years. Was the estimate. No one knows that for certain. But there were two senior partners, both of them 20 or so years older than I was. First day, the first senior partner came in, shook my hand, and said, "I have been wanting a day off now for years. I'm gone for a month." See ya. And then I'm like, oh, okay. The second day, the second partner walked in, shook my hand, and said, "God, great, you're here. Here's the cell phone, or here's the satellite phone. I'm also leaving for a month. Good luck to you." And so right out of residency, I had the entire town, took care of the emergency department, labor and delivery, the clinic, inpatient, the health department. I mean, essentially everything. I was just sort of given, really, it was terrible. It was terrifying. You can imagine being in the emergency room and taking care of someone who's having an acute MI, and then have someone come into labor and, at the same time, and have a bad baby and have to do a crash C-section, and then have to figure out how you can close the abdomen and then do the resuscitation on the baby. The only doctor in the county. And it was terrifying. So I had made a resolution during that time that anybody that ever came to this town would never have that experience again. And so all of the, hundreds of people that I have trained over the years, being an educator through the university with medical students and residents, and then of course my associates that I've trained when they've come here, everybody feels very well supported. And I am there come heck or high water, snowstorm or not, whenever you need me, and I will respond at any time for someone who feels like they're struggling, because I remember still to this day what that was like, and that will never happen again.
Yep. Well, as someone who, again, has just started working in the area, I do feel supported. Thank you for that. You've changed it. You've changed that culture significantly.
Well,
so
it's awful. Can you imagine?
No.
Can you imagine?
I can't.
Right out of residency. Oh my gosh. Yeah. So like I said, I quit every day for a month. And then it got better when everybody came back from vacation. Yeah. But there was not a culture of acceptance. Certainly. Yeah.
Can you tell our listeners about St. Vincent's Hospital? I know it's been here for
long time.
A long time.
Yeah, it was one of the first hospitals in Colorado. The Sisters of Charity started it, and they were from the Leavenworth, Kansas sect. I'm not sure what they're called, but the group of nuns. There was, when Leadville was bigger than Denver in the 1800s,
right.
They had asked for a medical facility, and so the sisters came. And they set up the hospital here. It was mostly them for a while before there were any doctors that came. There was a doctor in Breckenridge at the time who was a woman doctor, interestingly enough, but she never made it over to Leadville. So there was some care in town or care in the area, but not a lot. And if you remember in those days, horse and buggy, it took 2 days to get from Breckenridge to Leadville. So there wasn't a lot.
For those of us listening, it's currently about 25 minutes, 30. Yeah.
In a helicopter, it takes 4 minutes.
That's right. Exactly.
But, you had to go over the pass, and if it was in the middle of winter, it took 2 days.
Right.
In either case, they started that. They built their original hospital that was open until about 60, 70 years ago, and then they built the current facility that we're in. Mm-hmm. And now we're building our new hospital, which is across the parking lot. So this will be the third medical facility in Leadville with the name St. Vincent's.
It's a beautiful facility, too. It's a very exciting next frontier of medicine.
Yeah, it's huge. We've been trying to build another facility as this thing is aged. I think it was built in the 1950s, which even outdates me, which is impressive. But it's old, and it works just fine. But it would be, it's going to be great to have a new operating room, endoscopy suite, sleep labs, all of the things that, Leadville really needs. And as we continue to grow, it will continue to be profitable.
What does the future hold for St. Vincent's?
Yeah, well, that's a great question. I look at, how much longer I'm going to practice, and I really can't imagine my life without practicing medicine, but there comes a time in all of our lives where we probably shouldn't. I don't really know what that means yet. But one of the first steps is to grow our medical population, and so CarePoint is here now, staffing our hospital. And in April, CarePoint will take over the vast majority of the hospital-based patient care, which is my first step into maybe being on a floaty somewhere in the middle of the Caribbean at some point in my life. My legacy, I believe, is this new hospital and making sure that when it is built, it is well staffed, it makes sense for our community, and that we do things that really need to be done here, and that I get to pass the baton to the next generation of healthcare providers, and I can leave in good faith knowing that my little town is going to be taken care of.
Have you thought a lot about your legacy?
Yes. I think as we get older, I think that's just part of what happens, right? When you think about, what have I done with my life? What do I still need yet to accomplish? And then what does the last part of it look like? And I'm humble in the sense that I don't. It's hard for me to realize the value, but when I look back, and of course, episodes like this, I was honored a couple years ago for my 20th anniversary here, and just to hear people talk about what I mean to them personally and to this community. I mean, it's huge, right? I look at all of the kids in town. I'm like, well, yeah, I delivered this one, and I delivered that one, and now I'm on the second generation, right, of delivering the kids that I delivered, which is amazing. I look at all of the students, and who I can't even count anymore, right? How many there are, but probably thousands at this point of all the people that have come through Leadville who now look at primary care a little differently, who have gone into rural areas and helped serve, the underserved out here, and that impact. But more importantly, to have a community that knows if they need anything, they'll be taken care of, and that we'll figure it out, and that they can trust what's happening here. They can trust this hospital, they can trust the healthcare providers in town, they know the public health system works, the school-based health system, how functional that is. They know if they need something, they're going to be okay. Even if they're not going to be okay, there's still someone who will take care of them. They will never be left out in the cold alone. And I think honestly, that's really the legacy that I leave behind, is that this healthcare system that we have built here works. It works really well. And we did it without a big hospital coming in and saving the day. We did it without lots of federal funding, right, that comes in and supplements things. Not to say that we don't get that and we're not grateful for that. Of course we are. But we did it. And we did it because of the tenacity of the people who live here, and we built our dream.
I don't think one person could do the roles that you do, the innumerable roles that you play in the community. How do you succession plan? How do you find people who fit the need that one day they're going to have to do all of these roles? And we haven't even touched on all of them in this podcast. How do you find the folks to do that?
Yeah, that's a great question. I collaborate with people who are like-minded. And, your group, CarePoint, is one of them. Dylan has been, Dr. Layton has been here for years in our community. And I've heard about him through various mutual friends. He really wants to work here.
Yep.
He really wants to be part of this. And wasn't really sure how that would fit. So we met. And wow, I spent 5 minutes, having that conversation when I thought, this is it, right? This is how we bring in, the next phase. And what I had mistakenly thought is that there was going to be another me, right? There was going to be some other young physician who, right out of residency, wants to come and do this. And in the 20 plus years I've been here, that I've never met that person, even though I've searched and tried and hired and not gotten that level of provider who wants to do what I do here. And so having a group who comes in and says, absolutely, we want to do this. We can help you with this piece of it. Fabulous. Maybe we need to put the puzzle together instead of finding that one person.
Right.
We need to put the puzzle together. And then I've hired advanced practitioners who live locally, who have similar work ethics, who are ranch kids, who have children and are raising families here, who have that same level of commitment to the community that I do. And I've hired a team of them to help with the urgent care and the outpatient arena. And it's just another piece to the puzzle. We have an amazing administrator at this hospital here who is like no other administrator that we worked with before, who really, again, is at the sunset of his career. I don't know if that's a fair thing to say, but when you get to be our age, maybe that's what it is. But who looks at Leadville and says, this is it, right? I'm going to make this work. And because of him, we are financially healthy. We're building our new facility. We have so much more opportunity because he's here. And that really helped. It was another piece of the puzzle that put that together, where, for years we spun our wheels with looking for the big healthcare system that was going to come in and save us and didn't, or, the federal, component that would make such a big difference. And actually what it really was is us just rolling up our sleeves and putting another piece into the puzzle, making it work. Yeah. And so that's I think that's going to be the crowning achievement, right, of my legacy, is when this place runs without me and that they don't need me anymore.
When your students finish their rotation with you, what is it that you hope that they get out of it? What would you hope that they could tell you when they finish?
They understand how fun medicine is, and that it is such a joy to be invited into our patients' lives and to help them through their great times, to their worst times, to have a front row seat in their health and their wellness and their illness and their tragedy. And what a privilege it is to be part of that. There are very few careers, there are very few professions out there that allow that level of experience and that ability to touch people like that.
It is a privilege.
Yeah.
And it's a privilege to interview you today. Thank you for your time, Dr. Lisa Zwerdlinger. Your legacy is intact. You are a tireless advocate and committed to your community. And thank you for all of the time you shared with us today. Thank you for taking care of your own, as you've said, and thank you for sharing your time with us. And any final thoughts or recollections on stories in your career and time here?
Yeah, no, I think we've said enough, but thank you for being recognized. I think a lot of us are out there working tirelessly, and part of the reason why physicians burn out is that no one says thank you, or you don't hear it enough. I hear it enough. But thank you for being part of that.
Of course. Well, thank you. That concludes the podcast today, coming to you from the top of the world, the highest ER and hospital in the world, St. Vincent's Hospital in Leadville, Colorado. See you for the next podcast.
We are on a quest to provide the world with free medical education. Please help us out by rating us on iTunes, following us on social media, and subscribing to our newsletter at emergencymedicalminute.com.